Hello, I'm Dean Whiting, Pathology Technology Australia, and this is part 3 of our mini-series on COVID-19 antigen tests. You may have heard parts 1 and 2 where we talked about what antigens are, and we talked a little bit about how the antigen test might be used. In part 3, we want to jump into a little more depth of how the antigen test could form part of the arsenal of testing that we have against COVID and why it might be so important. You know, COVID-19 is, as has been described, a wicked disease, and it is for many, many reasons. It has a devastating effect on the elderly, on susceptible people, old and young. It has killed over 200,000 people now in the US and close to 1 million worldwide. And in Australia, we've been reasonably fortunate in that our governments have taken very stern and strict action. But it has come at a cost, a significant cost to people's lives, to in some cases their livelihoods, their incomes, and to some parts of the economy. So managing COVID-19 is different to any other infection that we've had to manage in 100 years. And that's why I believe the antigen test comes into its own. As you know, there are several formats of the antigen test. A rapid format, which could be used on site in workplaces and would give a result in 15 to 20 minutes. There's a laboratory format of the test, which can be performed in large quantities, in large volumes, on automated devices. But why would the antigen test be so important? Well, firstly, the antigen test can give us potentially a positive result very, very quickly. So imagine in a place where we have essential workers, such as food processing factories, where people work very closely together. Imagine the environment such as a healthcare environment, nursing, doctors, other ancillary staff. Imagine aged care facilities. So hospitals, aged care facilities, and essential manufacturing and other industrial sites are really key to keeping our economy open. If we can keep these workplaces safe and these environments safe for people to go to use, then effectively we could restart the economy, we could get people safely back to work and safely back to their lives. So how could antigen tests do this? Well, it's possible, in fact quite likely, that you could quickly screen workers as they come into or go out of or at some part during their day at work. You would be quite selective about which sites you would do this at. Certainly you would want hotspots, high-risk sites. You would want places where you absolutely need to eliminate COVID, such as aged care facilities. And you could be running these tests maybe each day when there is a small number of staff, or maybe every second day or every third day on people as they come and go from work. And you would very, very quickly pick up the positive cases. Now, there are very few positive cases in Australia at the moment. And so what we call the prevalence of the disease or the infection is very, very low. This is challenging for many reasons, and what we require in very low prevalence environments is tests which have a very high positivity rate. This is why the PCR test is so successful. It has a very high capture rate of real positives. Likewise with the antigen tests, we're now seeing some data come through which indicates that the antigen tests have a positivity rate in early phases of an infection of around 96%, 95%, some up to 97%, which means that very few people would actually slip through the net. And if we're testing every day or every second or third day, then by that second or third day, that an individual who potentially missed the first time round would be picked up. The other really important factor to know here is that COVID-19 is silent. The symptoms are silent in possibly as many as 80% of people. World Health Organization estimates that up to 80% of people are asymptomatic or have extremely mild symptoms. So this is part of the wickedness of the infection. It's very difficult to know who has the infection because some people can spread the infection without even knowing they have it. So this is why, even in a low prevalence environment, it's important to screen people coming and going from essential services, from healthcare and from aged care. And for a relatively low cost and a relatively quick and quite accurate result, it seems sensible to develop a protocol for testing in high risk, in essential staff, in high risk arenas and for essential staff. So that's a little bit more about the antigen test and how it could be used. In part 4, we'll talk in a little bit more detail about how potentially the antigen test could be used, added to our current tests in helping us with border crossings, with maybe a passport that people could obtain to demonstrate that they are COVID-free in order for them to be able to move a little more freely around the country. I'm Dean Whiting, Pathology Technology Australia.